bring in emergency medicine physician, Dr. Owais Durrani. Dr. Durrani, thanks for being here. So let's follow up on that latest from that Texas judge blocking President Biden's COVID vaccine requirement for federal workers. You're in Houston. Where are you seeing the most vaccine hesitancy, and how do you expect this might, I guess, affect the trajectory of this pandemic?
Yeah, thanks for having me. Unfortunately, it's kind of across the board. We'll see patients who are older who still haven't gotten vaccines or boosters. We'll see a lot of kids that haven't gotten vaccinated at all, especially in that younger age group under 12. And so it's, frustrating that we're continuing to have this debate on a federal and kind of national level over mandates and what's right and what's not, and even muddled messaging around boosters. And so that makes my job difficult when I try to convince patients to get a vaccine to prevent them from getting hospitalized. There's a lot of questions and uncertainty because I may be saying one thing, but when people turn on the news or go on social media, it says something else. We're still in the midst of this huge surge. Our waiting rooms are full. People are boarding in the emergency departments for hours on end. Transfers in and out of hospitals are almost impossible. And so things like this, where we are not getting the support from a national level to get vaccinations and get clear messaging, just makes everything more difficult.
And we appreciate the work that you do, Dr. Durrani, despite all of those hurdles that you and your colleagues need to jump through. Meanwhile, there are parents who want to get their children vaccinated, and younger children under the age of 5 haven't been able to be vaccinated yet. Dr. Fauci says that they may be authorized to do so as soon as next month. What should we be doing in the meantime to protect younger kids who cannot be vaccinated?
Yeah, that's great news. I hope that holds up true and we do get vaccinations for that age group soon, both from kind of my close friends and patients that I see. That's a huge kind of anxiety point for parents because in a lot of cases, the entire household will be vaccinated except for kids in that age group. And so families feel hesitant about, going out and doing things because those kids are still vulnerable. What can we be doing? We need to be vaccinated. We need to be boosted. And right now, in my opinion, fully vaccinated means if you're due for a booster shot, you need to be boosted to protect yourself and those around you in that age group, wearing high quality masks and then making some prudent decisions for at least the next few weeks when we still have Omicron so prevalent in essentially the entire country. And so that means maybe avoiding some high risk situations that we potentially could do come late spring, early summer.
You mentioned masks, and the White House is working to distribute 400 million free N95 masks after the CDC updated its mask guidelines. How much of a difference will these higher quality masks make in terms of preventing the spread of Omicron?
I think it's going to make a big difference. The health community has been advocating for N95 masks essentially since 2020. It's nice to see the federal government and national kind of idea around an N95 mask get there. And it's even more exciting to know that there's going to be millions available in pharmacies and other community locations that can be picked up. And I think it's going to make a huge difference when it comes to transmission, because in a lot of settings, people are not wearing masks and you might be wearing a mask. And with an N95, you're still going to be really well protected in that scenario. In my personal life, just as advice to anyone watching, I use it for about 40 hours. That's about 4 to 7 days. As long as it's not bent up or there's nothing spilled on it or it's not too dirty, you can use them multiple times. And so that's another kind of nice feature of those masks.
Let me also ask you about the free COVID-19 home test kits that can be ordered through a government website. More and more people are testing themselves at home. If you test positive, what should you do next? Who should you alert?
Yeah, so if you test positive, self-isolate, let all your close contacts over the last 24 to 48 hours know. Call your doctor and let them know, and that way they can report it to local health authorities, and that'll help with tracking. In terms of what you should do for yourself, in addition to isolation, taking over-the-counter medications like Tylenol, ibuprofen, cold medications for common symptoms, and then isolating for at minimum 5 days and seeing if you can get tested at day 5. If you're negative, you're free to, go about back to normal life. If you're positive, I would isolate further until you get a negative test. Now, sometimes tests are going to be hard to find, as we've all found out over the last few weeks. If you have to, go back into society and you're not sure, if you could get a test, wear an N95 mask for at least an additional 5 days, and that should at least keep those around you safe.
All right, Dr. Durrani, thank you for joining me, and thank you for all that you do.
Thank you.